Now we look at the next fractures, types of fractures we have as related to all those metabolic issues, that's mineral related issues. Okay. And this is fractures that you're having because somebody has what? Osteoporosis. Now, first of all, what is osteoporosis? Osteoporosis is basically the calcium that is present in bone that makes bone very strong is decreasing. Do you understand? So you are having an osteoporotic compression fracture. It's like the bones are collapsing on each other. Okay. So what we have for osteoporotic compression fractures, you see that there are spinal cord fractures and okay, spinal, okay, just the bones. And they occur when the vertebrae has been weak. So as has been weak, it has now collapsed. Okay. So mostly occurs in older adults and mostly occurs in women that have gone past menopause. They don't have much estrogen in their bodies. So estrogen, there's a way it helps in coordinating all those calcium and phosphate in bone. So what are they? It's collapse of a vertebral body because the bone strength has reduced due to an underlying osteoporosis. Do you understand? So it's usually triggered by just minor trauma, or the person just on his own is bending, you have the issue, or the person is trying to lift something, or the person is trying to cough or sneeze. As little as that. So little things that you are able to withstand before, because your bones are weak, they are now affecting you. So epidemiology, about 1.5 million vertebral compression fractures occur yearly in USA. So we always look at USA as what? The alpha and omega. Why? Because they properly always document their cases. These things are occurring in other countries, even higher, but we don't have the data because maybe some of these people don't even go to the hospital. But a USA citizen will always visit the hospital. So that's why we always use USA. So symptoms is there's a lot of pain, and the pain is occurring all of a sudden. Okay, and it's usually localized around where you have a fracture. You know, the pain worsens when the person tries to move. When he's resting, it improves. So you ask the patient questions around this area, and you know, there's lots of height and spinal curvature. In severe cases, nerve compression can cause leg pain and weakness. So diagnosis, just like I have imagings here, you have done your history, physical examination, you do your imagings like x-rays, MRIs, bone density scan, that's the DEXA, densitometry, you know, and also try to rule out cancers. So management is pain control first of all. The top complaint there is pain. So relieve pain with analgesics, short bed rest, bracings, physical therapies. You can do surgeries like what? Vertebroplasties, kyphoplasties, and the rest of it.